Hi, my name is Natalie Spanitz, and this is my Nursing Leadership 335 Clinical Objectives video. Objective 1 is utilize previous knowledge of the sciences, liberal arts, information technologies, and nursing to develop skills as a leader. I met this objective through my time with a 309 clinical group for my peer leadership hours. For half of our day together, we were in HBB doing the Bed Bath & Beyond party. I utilized the skills that I had learned in 309, such as bed baths, patient positioning, toileting assistance, oral care, things like that, to help the newer nursing students learn those skills. I practiced with them, I watched them, I demonstrated for them. In fact, like the clinical instructors actually asked me to demonstrate how to change a bed with the patient still in it and things like that. I also met this objective through my independent hours, where I helped out with the 311 students during their vitals lab. So having already completed 311, being checked off on my vitals and using my vitals throughout all my other clinicals I've done so far, I feel fairly confident in my vital taking skills. So I was able to help teach and assist the 311 students with learning their vitals and getting some of their vitals checked off. So we actually went over to the simulation room with SVED, and I taught them how to take all the different pulses and all the correct areas, including like the femoral pulse. And that's how I met Objective 1. For Objective 2, it says to apply basic principles of management to meet the challenge of an ever-changing healthcare environment. So our textbook by Sullivan for the class describes formal leadership as when a nurse practices and has legit authority deemed by the organization they work for and in their job description. So an example of a formal leadership would be a nursing supervisor, and I spent an 8-hour clinical day with my nursing supervisor. I was there from 11 a.m. to 7 p.m. and during this experience, there was 2 nursing supervisors. There was the one that I was with, and then there was a different one. So I got to see them act as a co-leadership, and they split up the different floors that we would have, and units that we would have to go to. So my nursing supervisor that I was with, we did all the med-surg floors, and then the other one did all the critical care floors. So I got to see them work together, divide up their tasks, and then complete those tasks. Also, during my advanced practice experience, I was on 2K South with the unit director. And during lecture, we learned about budgets and how like the personal budget is often the largest budget of the unit. So the 2K South unit director actually pulled up all of her charts and budgets and all the information, and she showed me how on her personal budget she was over budget, and that was due to the fact that she needed a travel nurse. So they have to take into consideration when they have a high patient census but a low staffing census, it could cause them to go over budget when they warrant the use of a travel nurse. Objective 3 is to demonstrate leadership skills through effective use of communication by representing the self, the college, and nursing in a professional manner. So during my nursing supervisor experience, I got to see how important communication is in a health facility, especially between nurses and the management and just all the staffing in general. I got to directly see how the line of communication works. So, for example, I was at Lehigh Valley Cedar Crest, and how I understand that it works is that whenever there's an issue, the nursing supervisor will get a call for the particular unit that there's an issue on. But usually how it starts off with is that a regular nurse will have this issue. When they can't resolve the issue, they go to their charge nurse. Whenever the charge nurse can't resolve the issue, they call the nursing supervisor, and then the nursing supervisor tries to solve the issue. And sometimes there are issues that can't be resolved by the nursing supervisor, or the nursing supervisor needs legal help, or just different things like that. So an example would be on 6K, the primary nurse of the patient was having a problem with getting sticking him for an IV. So she had issues, so she went to her charge nurse. The charge nurse tried. She couldn't get it, so she called the nursing supervisor, and the nursing supervisor was able to get the IV stick, but she would mention that if she wouldn't have, she would have called the PIC team to get it. So you can see the clear line of communication, and how whenever there's an issue, they follow this clear pathway to obtaining the result that they want. Also, I did an experience at Asbury United Methodist Church, and I worked directly with organizing and communicating with the parish nurse and setting up different stations for blood pressures to be taken within the facility. Number 4 is to critically evaluate and disseminate current research related to the principles of leadership and the effects on the healthcare system. So I plan to discuss this research article in post-conference, which is about leadership styles and job satisfaction. So it described transactional versus transformational. So transactional is like the scratch my back, I'll scratch yours, which we learned in lecture. We also learned about the transformational, which like the managers inspire the employees and that they want the change for the better. So in this study, they found that nurses actually prefer a transformational leadership, and that it directly affects and increases the job satisfaction when under the transformational leadership. Number 5 is to function as a competent patient advocate, nurse advocate, and change agent. So I was able to attend for my continuing education the St. Luke's 13th Annual Trauma Conference. During this trauma conference, there was a physician who works obviously in the trauma department, I think out near Pittsburgh, and he was advocating for the Stop the Bleed campaign. And so the Stop the Bleed campaign, its purpose is to prepare the public to save lives during life-threatening situations where someone is bleeding out. So they have this idea that they will gather kits, and in these kits there will be tourniquets and bandages and gauze and all the necessary means to stop someone from bleeding out. So this would directly affect healthcare, because if they have, after the like paramedics come to get this person and their bleeding has been stopped, the hospital receiving them can clearly see where the injury is at. They need to worry about, in a good situation, they need to worry about more of the injury site instead of worrying about the blood loss and doing blood transfusions, getting the volume back up, and certain things like that. So that is a cool initiative that I think should be implemented everywhere. And I didn't mention, but they wanted to put these kits everywhere where an AED would be, so the public could easily grab it and go. Number 6 is to formulate plans for continued personal leadership growth and development as an independent practitioner of nursing and contributing member of society. So there were 2 different experiences where I realized that I really enjoyed the educational side of nursing. One was my peer leadership for my 309 and watching Professor Orlando and how she is a clinical instructor and her ways of teaching just really made me appreciate clinical instructors and all their knowledge and how they help us through this journey we're on. And I really like the fact that I kind of got like a clinical instructor experience with them, because I knew a lot of the stuff and felt proficient in skills that we were doing. So I spent a day with them at the Cedar Crest Hospital, and I helped them with bed baths and vitals and things like that. So it was cool to see that. And also for my advanced practice, I did spend some time with the PCC and PCS. It was the same person doing both of those roles. And she was always had to be continually updated on her education, her knowledge, so that she can educate the staff and have it running properly. And both of these job descriptions or titles require an MSN. So that makes me think I want to go further after I work a couple of years and eventually get my MSN in education of nursing. Number 7 is to recognize the role of the nurse in policy making related to healthcare services at local, state, national, and global levels. So I was able to achieve this both through the Capitol Hill Day and the Pennsylvania State Nurses Association visit to our 335 lecture. Both of those experiences really reiterated the importance of a provision found in the ANA Code of Ethics, which is provision 9.4. So this basically says that nurses should be actively participating with other nursing communities and health organizations to represent the voices of nurses across the United States. So basically saying that us as nurses have to work firsthand at advocating for the change that we want, and to show the legislation that we want these changes done, this is why, this is how it could be done, and hopefully from them seeing it from a firsthand instead of someone else voicing our opinions, it will make a greater effect. And the final objective is number 8, and that is to predict and describe potential ethical dilemmas within a clinical organization and professional nursing practice. I observed an ethical dilemma during my advanced practice experience on 2K South, and I sat in with the meeting in a meeting with human resources and the unit director of 2K South. So they were having an issue with bullying. So nurses had complained about the unit's management and how they were being bullied because the nurses whom were less experienced were complaining that they were not getting the more critically ill patients, and that the management was assigning those critically ill patients to a certain group of nurses. So in listening to the conversation, I was able to see that the less experienced nurses felt like they had no justice, they weren't getting the fair treatment, they were never getting these really critically ill patients who were on things such as ECMO. But then from a nurse's, the management standpoint, they were arguing more for the patient's non-maleficence, so that the patient would have no harm against them. They wanted the patients to be taken care of by the nurses who have worked with ECMO for many years, instead of giving it to the newer, less confident nurses. So that was still an ongoing situation, and by the end of the meeting, they came to the conclusion that they were going to hold a staff meeting, and the unit manager, the PCC/PCS, was going to explain why certain people were getting certain patients. That is it for my video. If you have any questions, please let me know. Thank you.